Hi everyone, my name is Emily Roberts and I am a blogger for HealthyPlace.com. I'm also a therapist and I specialize in working with children, young adults, and women's issues. Today I was asked to speak with you guys about mental health stigma. And with the populations I work with, I've noticed quite a few things when it comes to the words mental health stigma. What a stigma generally is the kind of like the cultural perception of this word mental health or seeking out therapy. And there's a negative connotation. It means a lot of people think anyways, it means that someone's weak or they've got this weird thing going on, which isn't necessarily the case. Quite often, people who seek out treatment are more likely to have better living conditions, better living situations, happier lives the earlier they seek treatment. So the problem I see generally with a lot of parents is they're reluctant to get their child into treatment, depending on the issue, because it may say something about their family. They may internalize it to mean that they were bad parents, when really it could be a neurological, a biological issue that had nothing to do with what parents were doing. And then you have to also admit there's a problem. And that's really difficult for people to do. So what winds up happening is we get kids and adults in treatment later than they could potentially have been in treatment. If we get them early on in treatment or in therapy or observed by a psychologist, what we generally see are better outcomes, meaning that these diagnoses that they may have aren't forever. Some of the major things that we see are depression, OCD, PTSD, eating disorders, and anxiety in children and young adults that go unnoticed, or parents tend to push under the rug like it's going to go away or they're going to grow out of, and they don't. So the school is saying something, a family friend notices something, maybe one parent has this inclination that the child might actually be suffering from something more than just a phase of life. And they don't get the help that they need until it manifests in something much larger than they can manage. And the earlier we seek treatment and we admit there's a problem, the better outcomes we have. So my message for you is that if you are a parent and you are noticing that your child does meet some of these criterias, or they are not working optimally, they're not living their happiest life, it's important to get an observation, a neuropsych eval, a talking to a therapist, talking to a psychologist, even asking your school's counselor what they think. This is not admitting that there's a problem necessarily, but it's helping your child with something that they really can't tell you that they need yet. So in order to get the best outcome and get the happiest kid, it's very important to ignore the stigma or go against it if you can, because your kids are really needing your help in this. They can't call up a therapist on their own. It's up to you. So although we live in an age where I definitely do see diagnosis and I do see over medication, I do believe that checking in with somebody who's a professional to make sure these things don't get bigger and more out of control is the first and major step in making sure that we are helping our children and we're helping ourselves. So again, thank you for your time. And if you have any questions about mental health stigma and adolescents, young adults, children, women's issues, please feel free to ask me any questions and put them below, and I will be happy to get back with you. All right, take good care, guys.